The DuraGen graft matrix by Integra Neurosurgery is a unique and proprietary collagen graft for dural repair. Unlike any other system, the DuraGen matrix provides immediate closure to prevent CSF leaks and promotes natural dural healing, providing patients with real dura upon healing. The DuraGen matrix becomes a graft by interacting with the patient's body to optimize the natural healing process. The highly porous nature of the graft, which is 99.3% open porosity or void space and less than 1% solid, allows it to intimately conform to the margins of the dural defect and to complex surfaces of the brain once hydrated. Scientifically engineered pores allow platelets to infiltrate the matrix and initiate a fibrin clot. This rapidly creates a mechanical barrier to CSF leakage and holds the graft in place as fibroblasts migrate to lay down new collagen. As fibroblasts lay the foundation for new dura, the matrix is resorbed completely. DuraGen matrix is manufactured by Integra Life Sciences, a pioneer in the development and manufacturing of collagen implants and advanced regenerative technologies. Integra is a world leader in developing and manufacturing ultra-pure collagen, which has been used in more than 10 million tissue implants, including skin regeneration, chronic and acute wounds, and bone reconstruction. The Type 1 ultra-pure collagen used in the DuraGen matrix and other Integra implants is treated in a unique process that removes all non-collagenous components, including potential antigens and any viral and bacterial contaminants. In 30 years of use, these implants have made a significant difference in the lives of millions of patients, helping them heal with no confirmed reports of foreign body reactions or rejections. DuraGen grafts have been implanted in over 1 million patients. The DuraGen matrix family has the most published clinical support of any collagen-based matrix, including 10 peer-reviewed studies involving more than 1,400 patients. These studies analyzed results from different procedures where DuraGen grafts were used to close the dura. CSF leakage rates from these papers averaged 2.1% for DuraGen products, with a 1.9% rate of infection and 0% rate of foreign body reaction or graft rejection. This low rate of CSF leakage compares favorably to 7.5%, an average of CSF leakage rates found in other studies reporting on complications of dural closure using standard of care in different procedures. Let's take a closer look at the options for dural repair and what makes the DuraGen matrix a system like no other. For years, the only accepted method of dural closure was to use a watertight suture to directly close the dural margins. A fibrin clot would form around the closure to keep CSF from leaking. However, applying direct suture can be difficult or even impossible if the dura is degraded. This technique takes time and concentration, often at the end of a long case. The DuraGen matrix offers a solution when direct suture is not possible or practical. Physicians reported that such situations include older patients with thin, fragile dura that may tear. Cases where the dura has become dehydrated during long surgeries, when large portions of the dura have been resected, and when there is brain swelling and the dural margins cannot be approximated. Why choose the DuraGen matrix over other kinds of grafts? First, grafting with the patient's autologous tissue adds additional time and complexity, and harvesting may result in donor site morbidities. Non-autologous grafts that are strong enough for load-bearing sutures may be stiffer and therefore less able to conform to the convexity of the brain surface, allowing spaces to form between the graft and the brain and potential CSF leakage to occur. Repairing a damaged dura with a DuraGen matrix is as easy as placing the graft directly over the defect. Once the graft hydrates, it becomes a pliable membrane that attaches to the existing dura via surface tension and fibrin clot formation, thus eliminating the requirement for sutures. The DuraGen matrix is highly porous, rapidly absorbing fluids in situ, creating a natural environment for cells. As it gently conforms to fill spaces, the matrix becomes an effective layer between the brain and the overlying cranium and tissue layers, which begins to become integrated after the matrix is positioned and hydrated. As with any technique for dural repair, a fibrin clot forms to seal the dura. What makes the DuraGen matrix unique is the communicating open pore structure, which allows the matrix to fill with blood and plasma exudate. Type 1 collagen is an initiator of platelet aggregation and attachment, and therefore an effective initiator of clot formation. Platelets exposed to the porous structure degranulate to release clotting factors. The fibrin clot within the matrix creates an impervious structure that provides a strong barrier against CSF leakage and binds the implanted matrix to the edges of the remaining dura. So the collagen matrix that was 99.3% porous is now a leak-preventing fibrin clot layer. This slide is a section of a patient biopsy taken 1 day following implantation of the DuraGen matrix. We can see the fully hydrated collagen fibers, the red blood cells in the outer layer, and the open structure of the matrix filled with plasma and fibrin clot. The average pore size of the DuraGen matrix is 50 to 150 microns within the optimal size to allow rapid infiltration by fibroblasts. This structure enables fibroblasts to recognize the matrix as an appropriate environment in which to establish themselves and form new dura. At 2 to 3 days post-implantation, fibroblasts enter the honeycomb structure of the DuraGen matrix from the cut edges of the dura and from overlying and underlying tissues. The interconnected network of large engineered pores provides a scaffold for the cells to rapidly enter, migrate, and attach themselves. The pore sizes and distribution are consistent, ensuring efficient infiltration of cells throughout the graft and thus uniform tissue repair throughout the matrix. The collagen graft promotes fibroblast activity and acts as a foundation for the cells to deposit new collagen. Vascularization of new tissue follows the initial infiltration of the fibroblasts to form fully functional tissue. The DuraGen matrix is less than 1% solid, so the patient's own tissue fills the empty spaces, ultimately making a complete repair. As the new dura matures, collagen is synthesized by the fibroblasts so that the implanted material is completely resorbed, leaving only the patient's own new dura. In this slide, taken 2 to 3 days post-implantation, human fibroblasts are seen migrating into the DuraGen matrix to lay down new collagen. By 60 days after implantation, the matrix is fully infiltrated with fibroblasts, and revascularization of the new tissue is underway. In other matrices, closed porosity, small pore size, or layers of membrane can make it difficult for cells to migrate through the graft, leading to possible encapsulation or scar formation. The DuraGen matrix has been optimized for cell infiltration. A complete tissue membrane is established within 2 weeks of implantation. The new membrane acts as a permanent barrier to contain the CSF, replacing the fibrin clot that breaks down during the normal course of wound healing. The porous nature of the matrix, combined with the type 1 ultrapure collagen, provides a scaffold that is similar to the patient's own native collagen. The fibroblasts do not encapsulate the implant as with many other materials. Instead, they grow through the matrix as if it were a normal part of the patient's body and use the structure as a foundation for the construction of new dura. By 2 months post-implantation, the implanted DuraGen matrix is substantially resorbed and new dural tissue has formed at an appropriate distance from the brain surface and the overlying tissues, creating a new functional membrane without evidence of foreign body response or encapsulation. This is something primary suture repair and other grafts are unable to demonstrate. Approximately 8 to 12 months after implantation, the Neo-Dura has developed into mature functional dura for a complete and natural repair.